Hi, thank you for joining me today. I'm Deborah Costu, National Trainer for Alzheimer's and Dementia. Today you're in for a real treat. We're going to talk about a few things. These are many of the things just touching on the surface of some of the courses that I teach and train other people. I charge thousands of dollars for my training programs, but today we're just going to cover a little snippet. I want to give you some tips that you can use. Today we're going to talk about what is the difference between dementia and AAMI, which is age-associated memory impairment. So AAMI, or age-associated memory impairment, is just normal aging, right? We're all going to grow old, and we all have some type of cognitive decline, right? It may be just we miss a payment, or we forget what day it is, but we remember it later, or we can figure out to check the TV or check our phone or check the newspaper to see what the date is. We may lose something, right? We misplace something. Where are my car keys? Where are my sunglasses? But we can retrace our steps. That's called executive functioning. We can retrace our steps and go back and find that item. When we're talking about something more serious like Alzheimer's disease or another disease that has dementia as a symptom, that's when there's actual cell death in the brain. And we forget things that we recently have learned. That's why somebody with dementia may ask you the same question over and over, right? Because they don't know they just asked you that 2 seconds ago. They have difficulty following a plan. Certainly can't follow a recipe anymore. Sometimes they can't do puzzles anymore. They can't read a book. They have difficulty completing simple tasks and following conversations. Sometimes it's difficult for them to find a word, and they certainly can no longer retrace their steps, so that executive functioning is no longer able to be processed through the brain. A lot of times they start having a lot of poor judgment, right? Giving people their credit card numbers over the telephone. Yeah, we've all seen that, right? What about their diet? All of a sudden they're eating ice cream for every meal, putting on inappropriate clothing for the weather conditions. So that's really the difference between age-associated memory impairment, which is just normal aging, or if maybe we have a more serious problem like Alzheimer's disease, which you really do need to seek medical help and the profession of a doctor, or I personally would recommend a neurologist who specializes in the brain. I work with families in the past, and so many times they say, well, we see our regular doctor, isn't that enough? And I say, no, it's not enough. You should be seeing a specialist. If you have heart disease, you go to a cardiologist. If you have cancer, you go to an oncologist. If you're having cognitive issues, you should be seeing a neurologist, and a really good one. I don't know about you, but when it comes to my brain, I want someone who I can trust, who specializes in my brain and that can help me the most. So thank you so much for tuning in. If you found this informational, please hit the thumbs up, hit the subscribe button, and I will see you next time. I'm Deborah Costu. Thank you so much. Have a great day.